Hello, I am Manish, Faculty of Pharmaceutical Sciences, Madhav University, Sirohi, Rajasthan. Today I am presenting topic absorption of drugs. Learning outcomes are: after watching this video you will be able to know absorption of drugs and different routes of administration. Learn about gastrointestinal absorption of drug. Define mechanism of drug absorption. Absorption of drugs. A drug injected intravascularly directly enters the systemic circulation and exerts its pharmacological effects. However, majority of drugs are administered extravascularly, generally orally. If intended to act systematically, such drugs can exert their pharmacological action only when they come into contact into blood circulation from their site of application. And for this, absorption is an important prerequisite step. Drug absorption can be defined as the process of movement of unchanged drug from the site of administration to systemic circulation. The effectiveness of drug can only be assessed by the concentration at the site of action. The concentration can be measured more accurately in plasma. So, the absorption can also be defined as the process of movement of unchanged drug from the site of administration to the site of measurement. The definition takes into account the loss of drug that occurs after oral administration due to pre-systemic metabolism or first pass effect. Not only the magnitude of drug that comes into the systemic circulation, but also the rate at which it is absorbed is important. A drug that is completely but slowly absorbed may fail to show therapeutic response, as the plasma concentration for desired effect is never achieved. A rapidly absorbed drug attains the therapeutic level easily to elicit pharmacological effect. Thus, both the rate and extent of drug absorption are important. Such unabsorption pattern has several advantages. Lesser susceptibility of the drug for degradation, higher blood levels, rapid onset of action, more uniform therapeutic response, reproducible therapeutic response. Drugs that have to enter the systemic circulation to exert their effect can be administration by different route. So, what are the route of drug administration? So, the route of drug administration classified as the intral route, the parenteral route, and the topical route. The intral route includes peroral, like gastrointestinal, sublingual, buccal, and rectal routes. The GI route is the most common for administration of majority of drugs. Parenteral routes includes all routes of administration through or under one or more layer of skin, while no absorption is required when the drug is administration through IV. It is necessary for extravascular parenteral route like the subcutaneous and intramuscular routes. The topical routes include skin, eye, or other specific membrane. The intranasal inhalation, intravaginal, transdermal routes may be considered intral or topical according to different definition. Now, the GI absorption of drug. The oral route of drug administration is most common for systematically acting drugs, and therefore more emphasis will be given to gastrointestinal absorption of drugs. Drug must pass through one or more biological membrane at various locations. Movement of drug across the membrane is called drug transport. The GI linings allows most nutrients like glucose, amino acids, etc. pass rapidly through it, and it prevents entry of certain toxins and medicaments. Thus, for a drug to get absorbed after oral administration, it must first pass through the biological membrane. So, the question arises, what are the drug transport mechanisms? So there is different mechanism of drug absorption. The three broad categories of drug transport mechanism involved in absorption are transcellular, intracellular transport. This is subdivided into two parts: passive transport process and active transport process. Second one, paracellular or intercellular transport. This is also subdivided into two categories: permeation through tight junction or epithelial cells and persorption. Third one, vesicular transport. This is also subdivided into two parts: pinocytosis and phagocytosis. Transcellular or intracellular transport is defined as the passage of drugs across the GI epithelium. It is the most common pathway for drug transport. The three steps involved in transcellular transports of drug are permeation of GI epithelial cells, a lipoidal barrier. This is the major obstacle to drug absorption. Second, movement across the intracellular space, cytosol. Third one, permeation of lateral or basolateral membrane. This is of secondary importance. The various transcellular transport processes involved in drug absorption are passive transport processes and active transport processes. The passive transport processes subdivided into passive diffusion, pore transport, ion pair transport, or facilitated or mediated diffusion. Now second one, active transport, also subdivided into primary active transport or secondary active transport. Secondary active transport also having two types, symport and antiport. Now, paracellular or intercellular transport is defined as the transport of drug through the junction between the GI epithelial cells. This pathway is minor importance in drug absorption. This is divided into permeation through tight junction of epithelial cells or persorption. Now, vesicular or corpuscular transport. It is also called endocytosis. It is divided into two parts, pinocytosis or phagocytosis. So now this is the end of the topic. We will discuss more topics again in more videos. Thank you.